观众朋友们，晚上好，欢迎收看最新一期的子天访谈录 SD Talk Show， 我是子天 Skydo。Welcome to SD Talk Show. Hi, Dr. Mattioli.
Hey, Sky, how are you?
Very good. So happy to see you again.
It's my pleasure. It's always fun to speak with you and catch up on things.
Yes, thank you. So you know our audience, you are the most handsome eye doctor in Houston.
Well, thank you. I don't know about that, but thank you. Your eyes must be doing really well.
Thank you. Please introduce yourself again
Sure.
and to our audience.
Great. So, I'm Dr. Fred Mattioli, and I'm an ophthalmologist here in Houston. Been in practice now for over 23 years. And what we dedicate our practice to is helping people see better without needing any type of glasses or contact lenses, and always making sure that the eyes are as healthy as they can be.
Thank you so much. So how many years you'll be an eye doctor?
Well, now, this year will make 23.
Oh, 23. Wow,
Yeah.
That is a long history. So I heard about you already did more than 70,000 cases, right?
Right. So there's different types of surgeries that we do, and as just kind of a overview, we've done probably over 75,000 different types of surgeries, the majority of those being lasers like LASIK and SMILE, but we've really started to improve our technology. Well, the technology has improved considerably for lens implants. So for probably the last 10 years, we've been doing more and more lens implants.
So I'm so happy because Dr. Mattioli did SMILE for me on last year, February. So count now is already more than 1 year. My vision, I feel better than better.
Yeah.
I can see so clear.
Oh, that's fantastic. Yeah, no, thank you so much. That's what we do. I had laser myself actually 23 years ago when I was still studying. I was a resident in training, and I saw the patients that I was taking care of get treated by my professor. And I woke up one day and I said, that's it, I'm getting LASIK. At the time it was LASIK. I said, I'm getting LASIK done, and never looked back. It's been great.
So I think today we still want to knowledge some audience. What is ICL? What's different with SMILE and LASIK? What kind of patient can choose the best matching for them?
Yeah, no, that's great, because we hear so many different things on the radio or in social media. There's PRK, there's SMILE, there's LASIK, all these different types of treatments, and LASIK being the most popular just because is really good and it's been around a long time. So SMILE is a newer variation of that, and newer meaning for the United States. It's been maybe 3-4 years now. So it's been some time, but really internationally, especially in Asia, much more SMILE is done than LASIK because it's been available longer than in the United States. But our group is always looking for the latest technology, what's working best, and if there's advantages to that technology, such as SMILE, then that's what we do. And so we do the most SMILE in the city and in the state.
Yeah, so I did the SMILE, so I know it's very simple procedure, can I say. I'm not using the surgery.
Yes,
Yeah.
You're right. You've lived it.
Yeah.
So the procedure's fast, it's quick,
Yeah.
it's maybe 10 to 15 minutes for both eyes.
I
So
think
it's
less
pretty
than that.
Yeah, sometimes it's less. A good patient makes it even easier. So
Yeah.
Sometimes it could be, less than 10 minutes for both eyes treated. And so, it's just done with eye drops to numb the eyes, so there's no kind of injections or the only anesthesia we need are eye drops, just like if you were having an eye exam.
So everybody know LASIK and SMILE. I think the people not too familiar with EVO ICL. Can you tell in the audience, so what's different and who is good for ICL?
Right, so that's great, because EVO has also been around since, ICL, which is the original technology for lens implants, has been around since 2005.
Oh.
So in the U.S. and even longer internationally.
Oh, yeah.
So I actually did some training in South America specifically for ICL before it was even available here. And so the difference between ICL and LASIK is that LASIK is a laser, like SMILE, that we do on the outside of the eye. ICL is a lens implant. It's almost like a little contact lens that goes inside the eye. Now, EVO, which internationally has been available for a long time, has also been available in the US. And EVO is just the evolution, the newer lens of ICL. So it actually made a two-step procedure. We used to do ICLs in 2 different steps. Now we can do it all in 1 step. So EVO has made it even better and safer. The candidates that are good for EVO kind of overlap with LASIK and SMILE. So as we mentioned earlier, it's confusing sometimes when you hear about all these different types of treatment and, you know, well, my friend got this, well, my doctor recommended that. So the best thing to do is to come in, we'll measure all your measurements like we did for you, and see which is the best procedure, because there is some overlap between all 3 procedures. So the EVO ICL is typically where most people use it is for higher prescriptions. So there's people who are told, well, you're not a candidate for LASIK, your numbers are too high, your prescription's too high, or for SMILE, and that's where EVO, a lot of EVO is done. Now, EVO ICL can be done in the lower type prescriptions as well. And we've done that because sometimes the people come in, maybe you don't have a big prescription, but when we do all the other testing, we see, well, the surface doesn't look so good. Maybe we shouldn't touch the surface too much, not do lasers, and we can still do ICL. So to know who's the best candidate really is, for which procedure really is just to come in and we'll do our testing and work with that.
So I know all the procedure is still can do second time or only 1 time?
Most of the procedures we can repeat.
Okay.
Even though it's really unusual. But yes, if we need to, we can do a SMILE, let's say, and then if something else needs to be done, we could do a LASIK or a PRK. Sometimes we do the EVO ICL, and because the prescription is so high, even EVO doesn't make it, maybe 90%, and that's okay. We'll do that, and then we can come back later and do a SMILE or do LASIK after that. Some people who have had just primary LASIK, you know, their first procedure, over the years, their inside of the eye changes. Remember, LASIK and SMILE are outside the eye. So the inside is still going to age. We get older. And so the vision can change. And in those cases, most of the time I can come back and add some more LASIK. Or maybe at that point, you know, maybe it's been 10, 15, 20 years since you had laser, like LASIK, and now it's time for the lens implant. So there's many things that we can do to always keep the vision as good as possible.
Thank you. So we've been talking about a lot about your procedure, your customer. I think audience also interested, what is the eye doctor's work, the all day looks like? From morning, and then maybe you want to know what's a challenge for you, for your career, you know.
Yeah, well, that's great. The typical day is one of the reasons that I went into ophthalmology, because it's a good mix of clinic. So you get to see patients in a clinic setting, and it's not all surgery. I mean, you know, we do see patients who, you know, maybe aren't good surgical candidates. For example, we had a patient who was young, 29 or 30, came in on Saturday and has a very high prescription, but he doesn't have enough room to do an EVO. So in that case, we're gonna wait. You know, it doesn't, just because you come in and, you know, would like to get something done, we always want to make sure, as I mentioned earlier, not just help you get out of contacts and glasses and live life to its fullest without any type of eyewear, but we also want to make sure it's safe for you. So sometimes we wait and just see if new technology may be available, if you know, maybe some other procedures as you get older might be better. So a lot of it is very interactive with the patient, what your needs are, but also educational. That's where I feel what we need to be doing is educating our patients as they come in as well. Because unfortunately, too, there's a lot of miseducation and misinformation that goes around just from regular doctors who may not be familiar with the type of work that we do at our practice. So there's a lot of clinic and a lot of discussion, a lot of time with the patients. And as you know, the surgery is generally very quick. So we can do you know, a fair amount of patients' eye surgeries, but the real, and it's fun for me, but the real interesting part is finding out what patients need and how we can match that.
I think you say education. I really like this way to the patient because you know a lot of people coming to the clinic, they don't know what exactly they want. They don't know if LASIK, if a smile is matching, and they have the fear, you know. So education for them is a really good way to take out the fear. For example, if a patient like 55 years, it's not just nearsight, it's multiple problem for the vision. They want to talk to you. What's your suggestion?
Sky, that's great. We probably run into those types of questions, at least every week.
Yeah.
Because as we were saying earlier, somebody, maybe your neighbor, a friend, a family member got one procedure done, but when you come in, your situation is going to be unique, right? And so we customize our treatments towards what everybody, what it is that you need. And sometimes people look for, we all want to be 20 years old again, and our eyes aren't, we can't do that, but we can get very close these days with the newest technology, which is trifocal.
Oh, okay.
So you may be familiar with a trifocal pair of glasses where you can see far, you can see the computer, and you can read. And that's great because that technology has come a long way. We put in some of the first lenses when I was just finishing training and starting my practice. But like everything else in science, the technology improves. So now we have really fantastic lens implants that are better at achieving that driving vision plus your computer work and then of course reading. So sometimes people who come in wanting one type of procedure because they heard about it or because they're familiar with it, and they finally got enough courage to come in and say, this is what I want, and then it makes our job a little bit harder because now we have to re-educate you. Yes, that is a great procedure, but this is even better for you. And so that's where we spend a lot of time in discussion with the patients, because if you're not comfortable, we don't want to do the procedure because you should be ready for it, and you should understand it. And so we spend a lot of time with educational materials. The doctors, the technicians are all educated on all the procedures that we do, because that's really the most important thing. We want you to feel comfortable and have a great experience, because we know the technology is there, but yeah, sometimes it just takes a little encouragement to understand which procedure and why we recommend that.
You just talk about a unique. I know some patients, one eye is nearsight. Maybe one eye is far sight. So like this situation, they have to choose maybe LASIK or smile, different eye.
Yes, that's a great point. We actually have patients who have LASIK in one eye or smile in one eye and then have ICL in the other eye, because they're very, very nearsighted in one eye, not so nearsighted in the other eye. And so sometimes, we do that, exactly. And that's the reason people will call and say, well, can I get LASIK done? We really don't know until you come in. So many things: age, what your prescription is, what your needs are. So all of the procedures we can either do individually or combine them to treat just about everything. Reading problems, farsighted, nearsighted, astigmatism, all these things we have had for a while, and even better treatments now for all of those issues.
So what's the age criteria? What's the youngest age and the oldest?
So the youngest is 18 years old with a stable prescription. So, we want to make sure that things aren't changing. But typically by the age of 18, 91% of patients' vision is stable. So it's not going to change. Yeah. And then we run into a second vision change as we get older. So around our age 40, even if you have great distance vision, your reading starts to become a problem. This is where you go until your arms aren't long enough anymore.
Yeah.
And then you put on the little reader glasses that'll help. But of course, you look far away, you can't see anymore. So you're on and off all day. So that's the second issue that we run into. It's typically around age 40. If you already wear glasses and hit age 40, then you use a bifocal or a trifocal. So depending on what your needs are, if you do a lot of computer work, you're going to need that mid-range for the computer. And all of that, typically, again, if you're a candidate for it when we do our testing, can be taken care of with those trifocal implants that we were talking about. So yeah, so the trifocal implants go inside the eye, and they're permanent. It's a permanent prescription lens replacement.
So if the senior like 75, 80, they still qualify to do, or what's your suggestion?
No, that's correct. There's no upper limit.
Oh, okay.
Yeah, I think my oldest laser patient, LASIK patient, is maybe 85, 86.
Oh, okay.
And my youngest lens patient is maybe 42.
Oh, okay.
Yeah, and then laser is 18 and older. So yeah, no upper limit. The health of the eyes is the most important. So make sure, taking care of blood pressure, taking care of diabetes, all those things when you're young, right? If you have those issues, absolutely can affect your vision. And sometimes if it gets to a certain degree, there's not much we can do anymore. So very important to take care of that early. Doesn't mean that you can't still do something. People get cataracts. Well, we get cataracts, right, as we age. A cataract is when the lens inside the eye is cloudy. Much more common in diabetes, but either way, if we live long enough, we'll all have cataracts. So there's no reason to suffer through that. In fact, one of the things that we do is treat with lens implants before you develop cataracts.
Yeah. So I know you're expert for procedure, but can you give some suggestion for the kids, students, like how to protect your vision?
Sure. Yeah, especially now with so much digital work that we're doing, computers and things like that. So interestingly, there have been, that's actually a study done. We're going through something right now where the younger generations are developing myopia faster and to a higher amount. And so it's been shown in a large study in Asia, actually, where one part of the study, the children who essentially were outside more and using their vision more past this point actually developed less myopia than those who are more confined and in front of a computer or playing games and sit right in here. So so very important to have a balance of everything.
Yeah.
And for the proper vision development. The other thing is sun protection. So just like we protect our skin, we want to protect the eyes from excessive UV, ultraviolet sunlight over your lifetime. So those are the main things. We are seeing a lot of more nearsightedness at a younger age.
I think all the kids, probably everybody has a nearsight problem. Yeah.
So there's a large genetic component to it. So
especially now.
Yes, and I think it's probably about 80% of the Asian population with nearsightedness. So it's very, very high. So anything we can do to reduce the further development of it, we can't change our genes yet. So if you're getting nearsighted, making sure that you're stimulating your vision as farther away rather than up close for several hours a day is actually better. Typically then, as you get older, your choices of being able to correct that nearsightedness are, there's more choices. You have more options, SMILE, LASIK, ICL, EVO, there's a lot more you can do. You're not becoming more isolated because now you have very high myopia. The other issue, and more importantly really, is high myopia can lead to other problems, Sky. It can lead to things like glaucoma. It can lead to retinal detachments, and it can lead to early cataract development. So there's a lot of reasons why myopia is something that is not just bothersome because you have to wear glasses or get a surgery to see better, but there's significant ocular health problems that could develop that are more common in myopia.
How about a senior age? What's a suggestion for protect the eye, the vision?
Yeah, so definitely for everybody.
It's the same?
Yeah, it's the same, but also healthy eating. So
healthy eating.
Lots of antioxidants.
Okay.
A good diet. There's no secret, diabetes, blood pressure, weight gain, all these types of things that, from all the processed foods that we eat. Having fresh vegetables, just, healthy foods is something that you can do lifelong. Definitely as you get older, the potential for disease development in the eye, glaucoma or degeneration of the retina, macular degeneration, these different types of things, when picked up early, can be treated. So in the older population, I would say make sure that you're getting your eye exams, a comprehensive eye exam, at least once a year. And even more frequently if you already have problems. If your doctor recommends, hey, we should see you twice a year, or if you have glaucoma, maybe we should see you 3 times a year, just to monitor things, because the better you can control these processes, the better your outcome will be. And I would say, you know, really enjoy your vision as much as you can. Some people, unfortunately, we see really wait a very long time before they get cataract surgery. We see cataracts, normal cataracts, start developing really around age 45.
Oh, sorry.
They may not interfere with your vision, you may still be seeing well, but by the time you're 55, 60, we're looking less and less at LASIK and more at just getting rid of those early cataracts, because unfortunately I see a lot of patients that wait and wait and wait to where their family members are taking them around, or, you know, they can't see the TV anymore, they can't recognize their friends, and, you know, then they're being told, well, yes, you have cataracts, but you still see okay. Well, if any of those things are happening where you're not enjoying life, even if you're 80, you still need to have that evaluated, and the cataract procedures are, you know, 15 minutes.
Oh,
So, yeah,
okay.
so it's don't require hospitalization, any of that. So there's no reason to wait and not enjoy life.
Yeah. I also know, Dr. Mattioli, your clinic has a payment plan, right?
That's correct, yes. We have people specifically in the office that help with financing. So we have different types of financing that are available. So yeah, our goal is to make it as affordable as possible to
help everybody.
Yeah, to help everybody. There's, you know, if you can be seen better, then we feel like, yes, you should be.
Yeah, that's great. So today, thank you for your knowledge.
Yeah, my pleasure.
Yeah, you answer all the questions. I think the audience will be curious. Also, I want you to repeat one more time the location and what's the availability, maybe how long it takes the reservation, how long it takes the procedure. Yeah.
Okay, sure. So yeah, so it's Mattioli Vision Professionals, part of IQ Laser Vision, and we are at 2200 Southwest Freeway, Suite 500. That's in Houston, and the zip code is 77098. And we have people that speak fluent Chinese, people that speak Vietnamese, English, Spanish. So we try to help everybody feel comfortable when they call to make an appointment. Availability, we are Monday through Friday, and the best thing is to call and see what times work for each person, you know, for a patient to come in. We tend to do our treatments towards the end of the week, Thursday and Friday. People like to have the weekend, even though you know it's very fast, you can pretty much be at work the next day.
Yeah.
But people tend to prefer those days so they can have the weekend to recover and relax. Yeah.
Thank you so much. Yeah, I know Dr. Mattioli is an angel doctor because he did a procedure for me. It's already been 1 year, 4 months. I think my vision is better than last year. Even I go to swimming, I go to sauna, still very perfect. Yeah, I so appreciate.
I'm so happy for you.
So I think a lot of audience has a fear thinking about, oh, maybe I will have a risk, right? Can you, by the end of the show, telling the people how to challenge your fear?
Sure, yeah, it's absolutely normal to have some sensation of fear. I mean, I did, and I was watching all these patients come through, right?
Yeah.
And I'm in the field, but the reality is, yes, there's risk, but it is extremely rare to have complications that are vision-threatening, sight-threatening. So even though, you know, okay, well, the LASIK wasn't 100%, you know, okay, but you can still see, and you may see a little bit better with a small pair of glasses. Maybe we can repeat the LASIK a short time later after you've healed. But the actual risk of, say, infection or losing vision, you know, things scarring, things that people wonder a lot about, are very, very rare. So LASIK's been around 25, 26 years. Things that have high incidence of risk, serious risk, don't last very long at all. Smile's been around for a long time. ICL, EVO's been around, again, at least in the US since 2005, and worldwide even more. So with millions and millions of procedures performed around the world, cataract surgery is the most common surgery. We need it, you know. So these are all things that carry risk but are extremely rare. I haven't told you this yet, but I have a lens implant now.
Oh.
Yeah, I have a lens implant in one eye 3 months ago.
Oh.
Yeah. So I'm not going to tell you how old I am, but I was ready for a lens implant. I didn't want to do another LASIK, even though that was an option. But I preferred to have a permanent solution, which is a lens implant. So what we do are permanent prescription lens treatments. And so, you know, knowing the risks, I'm a LASIK patient, I'm a lens implant patient. All my kids that need LASIK have already had LASIK. My family members, I mean, other doctors. So yes, the risk is real, but it's very, very rare.
Thank you so much. Also, our audience, you can make a phone call under the screen. We have a location and a phone number. Also, you can scan the WeChat code. Thank you.
My pleasure, Sky. Thank you.
Yeah, I see you next month.
We'll see you then.
Thank you so much.
Thank you.
这就是今天的子天访谈录。I see you next week.